Hi, everyone. If you don't know me already, my name is Dr. Aylah Clark, and I'm one of the naturopathic physicians at Whole Health Wellness Center. So tonight I wanted to do a talk on brain fog because it's one of the most common issues we see in practice. We see, um, I would say, certainly every week, people talk about brain fog, um, and if not more often than that. And so I'm going to go through some of the reasons why somebody might be experiencing brain fog and some of the naturopathic strategies and approaches that we can take to try to address it. So here's a little list of what we'll talk about. Really, it starts in the beginning with just what is brain fog, some of the important notes to make about attention, distraction, energy needs, how inflammation and oxygen can play into brain fog, major causes of brain fog like COVID and concussions, and then getting into both some causes and treatments with sleep and exercise, hormone contributors, stress, and then a few extra natural therapeutics there at the end. So, a lot to cover. I'll try to keep you engaged, and that's hardest with people who suffer from brain fog. So, let's go ahead and get started. So, first of all, brain fog is not really a medical diagnosis. It's described generally as having a lack of mental clarity. Maybe you're forgetful or have just some difficulty focusing on tasks. If you're trying to be fancy, some people will call it neurofatigue. But more commonly, I hear brain fog. And so, as I mentioned, there are a lot of different causes we're going to talk about hypoxia, which is low oxygen and inflammation, hormones, poor sleep, stress, all that. I think the closest to a diagnosis code that you'll see is probably mild cognitive impairment, so stated. Um, but but the reason why there's not another code for that that's more specific is because there are just so many causes. So let's get to it. All right, so attention and distraction. These are some things we need to talk about before we get into some of the other nitty gritty. First of all, right now, today, in today's world, there is such a great demand for your attention because it makes people money. The apps you use, the ads you see, they're all trying to get your attention and keep it for as long as they can. And there's all kinds of techniques that they use to do this. Apps are designed to be addictive. Endless scroll really was a major contributor to this because there's just no end and you keep going and people stay on these things forever. Same thing with, with some of the streaming services, switching to another show in 5 seconds, or these quick little videos that are just constantly trying to grab your attention just a little bit longer. So be aware of where your attention is being drawn to, and you can do things to try to get control back. We'll talk more about that. So, another bit about attention and distraction is that some studies have shown that receiving a text message can actually distract you enough to reduce your brain power by 30%, which is pretty substantial. And that it actually takes you an average of 23 minutes to get back into deep concentration after being distracted. And so that means that if you're not getting 23 minutes or longer without a distraction, you're operating at lower brain function most of the time. So the longer you can try to live your life without these distractions, the more concentration you'll be able to have. Another note here with attention and distraction is the myth of multitasking. I'll tell you now, you're not as good at it as you think you are. Um, it's hard not to slip into that and feel like you're just getting stuff done. All kinds of things are being worked on simultaneously, but the research shows that that is just not the way it works, that it wastes more time than it saves, and you're really robbing yourself of that deep work and concentration. They've done research that even shows that practice does not make perfect, that people who multitask more are actually less good at it. So you actually lose some of that ability to focus if you're constantly moving between tasks. So stop it. Stop multitasking, go one thing at a time and work down your list. So a little summary of what to do based on this attention and distraction. It, I'll say too, this is an uphill battle because a lot of these screens and things that are grabbing your attention are really designed against you. They're trying to get your attention all the time. They're designed by very smart people, and so it's not that you're just not able to do it because there's some weakness. It's because it's a battle. And so if you can try to find ways to reclaim your attention, then you can you're more likely to have some boundaries with you and technology. So set up app limits on your phones. I've found I've had different types of phones. I think that iPhone is not as good at this because it's too easy to turn off. Um, so be aware of that, and maybe that's changed. Turn off notifications if you don't need them. Consider deleting apps and accounts, and designate that screen time for maybe certain times of the day. I like the rule no screens in bed. That's good sleep hygiene practice too. And I think it's important to really think about how you want to spend your time each day and organize yourself in the tasks you want to get done. And those could be positive things that you want to do. Do you want to paint? Do you want to read? Um, and think about that maybe at the beginning of your day and strategize to make sure you're spending your time the way you want to. I think setting up quiet hours while you're working can be helpful. That could mean a sign on the door. I know that's harder if you're working from home still and have kids at home or whatnot, but I think that's important in order to get that deep work. You need to limit those distractions as much as you can. And practice focusing. If you aren't reading, maybe start reading again. Um, if you haven't tried meditation and tried some of these exercises of doing nothing but relaxing your body for 15 minutes or something like that, then maybe give that a shot. But it does seem that you can get better at it. All right, on to the next slide. So this next section is on the brain's energy needs and nutrition. The brain uses a lot of energy. It needs it just even at rest. You're using 20% of your energy for brain function, and a lot of that, two-thirds of it, is to help your neurons fire, but a whole third of it is just for maintenance, housekeeping, cleaning up cell waste, etc. So we want to give your brain lots of good fuel. You can do that by targeting nutrient-dense foods like key nutrients like vitamin B12, choline, vitamin D, iron, omega-3s, and folate are some of those major ones. These can be found in foods listed at the bottom, are a good example of some of those uh, brain fueling foods: nuts and seeds, avocado, salmon, mushrooms, especially lion's mane and cordyceps. And if you're watching Last of Us, it's not that cordyceps. It doesn't work like that. Um, and to think about how much of your brain is actually made of fat. So 60% of it's fat, and so things like omega-3s, especially DHA, can really fuel your brain. Protein is also a good source of sustained energy. Carbs are that quick energy. So, and we'll talk more about that on the next slide. Diets that have been studied for brain health are primarily the MIND diet and the Mediterranean diet. So you can kind of look at those as a more broader picture of what that could look like. All right. I know I'm moving a little quickly, but I don't want to keep you here all night. So nutrition strategies, another one is stabilizing your blood sugar. So if you look at the pink line there, that's an example of what can happen if you're eating a more standard American diet that can give you a big burst of blood sugar. gives you a temporary energy surge, and then it can plummet. And then you get that crash, and that dip down there at the bottom is brain fog. That's a at least that's where it happens to a lot of people. Sometimes you might see that a little bit after lunch, where you just feel sluggish. So a way to mitigate that is giving yourself more sustained energy, giving it a better glycemic response by pairing carbs with healthy fats and protein. Um, some people that wear continuous glucose monitors have found that even the order of the food you eat can affect the glycemic response. So consider starting with your vegetables, proteins, and fats, and then doing the carbs later in the meal. Sometimes that can make a difference. And overall, low sugar. It's hard to outrace sugar with this if you're just loading up on sugar. For many people, I recommend under about 25 grams of added sugars per day. But thinking about the whole macro content of meals is a good strategy. Another important nutrition strategy I cannot skip over is hydration. Water actually can make a big difference in your cognitive function. And there were some stats I pulled here that I thought were pretty fascinating that a 1% degree of dehydration can cause a 5% decrease in cognitive function. And I can't tell you off the top of my head what that looks like of how you would know you're 1% dehydrated. 2% dehydration showed impaired cognitive performance, attentiveness, short term memory loss, and decreased decision making ability. And prolonged dehydration, and this is really, I wouldn't worry as much about this. I would just, there are circumstances where you might have prolonged dehydration where you can actually see a decrease in brain volume. Um, so, bottom line, stay hydrated. Um, there are some different rules of thumb for that, and it can be a little different depending on the person, your activity level, how much you're sweating. A lot can go into that. Uh, Half your body weight in pounds in ounces of water is one rule of thumb. For some people, that might be a little on the high side. Um, so you can take that with a grain of salt. But most of us can use a little more water in our lives. All right, inflammation and hypoxia. So hypoxia means low oxygen. And one of the ways this kind of big picture tends to work is low oxygen flow into an area like your brain can cause inflammation and it can cause cognitive dysfunction. So this can happen in big events like a stroke, cardiac arrest, suffocation, where you really see a part of the brain and like in a stroke can have a loss of oxygen and from lack of blood flow to that area, and then you get cognitive dysfunction. So that's a big obvious picture of when that can happen. But that can happen also chronically due to vascular impairment, like with high blood pressure. High blood pressure can cause capillary leakage, and there's less oxygen getting to where it needs to go over a long period of time. So, some people with high blood pressure are more likely to experience brain fog. Sleep apnea is another major cause of brain fog. What happens is when you're sleeping and you're starting and stopping sleeping, which is what happens in sleep apnea, or stopping and starting breathing, excuse me, you're getting alternating oxygen levels where it goes high or normal levels of oxygen and then low oxygen states. And that fluctuation can lead to the production of reactive oxygen species, which cause oxidative damage and inflammation. So if looking for any untreated sleep apnea can really be a huge benefit to somebody that has that and is experiencing brain fog. And COPD is a chronic obstructive pulmonary disease, is another low oxygen state that you can get uh, reduced cognitive function and be over time because of that chronic low oxygen. Okay. So another way that you could get inflammation and brain fog is actually from your gut. So to give you a little bit of insight into the connections here, There's a large study that looked at 9 studies comprising of 705 articles, and they found that dysbiosis, or an imbalance in bacteria, significantly linked was significantly linked to depression, dementia, schizophrenia, and other mental health disorders. And this is a fascinating area of research, and it's we find that the this imbalance of bacteria can result in the release of LPS, or lipopolysaccharides, by the gut bacteria that can cause more inflammation. And it's closely related to the brain through several mechanisms. There's even some, uh, so vagus nerve is a big one. Vagus nerve runs from your brain to your gut. Another one has to do with the tight junctions or leaky gut. So I'll explain that briefly if you haven't heard of that. If you look at the picture here, on the left side, it's a normal, healthy gut where the intestinal cells are close together, and the food particles and bacteria and things there's a barrier between your blood vessels and everything in the outside world. Now, because most of your immune system is here, you really, in which you want, because this is the biggest surface area you have with the outside world. Not your skin, it's your gut. Your gut has a huge surface area, and that's where your body determines, what comes in, what stays out. And so if you have a lot of inflammation in your gut, or an infection that might cause inflammation, um, for example, the spaces between your cells can be wider, you can get more inflammation, more things get through, and you have an inflammatory response by your immune system as it identifies more things as foreign invaders. They're not coming in the way they should through the proper channels. So I know it's a lot to take in if you are not familiar with leaky gut, but the other connection is that there's sometimes it appears that there may be sort of a leaky blood-brain barrier that can be related to leaky gut. There's some indications that that might be the case as well. So, all right, hopefully I haven't lost anybody here. So I did want to make a few notes on post-COVID brain fog, because so many people have this now. Um, so one of the many long-term symptoms of post-COVID syndrome is brain fog, and studies have shown that overall cognitive decline, or cognitive performance, significantly declined. It happened more so in people that had anosmia, which is the loss of smell. If they had that for more than 2 months, they were more likely to also have brain fog. And in one study, post-COVID brain fog persisted for more than a year in about a quarter of participants. So for some people, this is really a persistent problem. And the reasons why reflect the same reasons above from those last slides, of inflammation and low oxygen. So in COVID, you can have vascular inflammation. There was one study, it's a small study, that had 77% of patients that had post-COVID cognitive defects had changes in their cerebral spinal fluid that reflected systemic inflammation. And that's because viruses can cause vascular damage. The vascular damage can result in protein leakage and an inflammatory response. And in some cases, there's evidence that the virus may actually cross the blood-brain barrier and cause a local inflammatory response in the brain as well. And so that impaired blood flow can result in low oxygen to the brain. And you need that oxygen for neurons to fire. And and this is interesting too, some of the immune cells actually block capillaries. So there's some very large immune cells called megakaryocytes. And because your capillaries get so small, they can get to like one cell length apart wide, just for red blood cells primarily to get through there. And megakaryocytes are just so big, they can occlude some of the smaller aspects, the more distal parts of capillaries. So that's another way that can happen. And I know these are mainly talking about things that can go wrong, so we will continue and talk about how things can go right too. Um, and so one note about post-COVID brain fog is it's primarily subjective of when did it start and is it following the same kind of patterns we're seeing in other people with post-COVID brain fog. There was some research that showed that the kynurenine pathway was activated, which is a pathway involved in cellular energy production, and it's more active in general when you have an immune response. And you actually can test those metabolites, but it's a specialty lab, and that's not usually necessary. There are some cases where we've really tried to tease out, is this related to COVID still, or is this due to something else? And that might be useful in those cases. All right, so then a couple notes about traumatic brain injury or concussions. So the same sort of thing happens with concussions and brain fog, where you get inflammation and you get vasoconstriction of blood vessels and low oxygen. You also get this huge energy deficit, so much that it's called an energy crisis. And this is an energy deficit in your brain specifically. So this energy crisis and low oxygen can cause neuron damage in some cases. And another important thing that we see is that acetylcholine, which is one of your neurotransmitters, it's important for cognition, vision, information processing, is tends to remain low in people with chronic cognitive deficits following concussions. I don't know of any studies off the top of my head that have shown this in post-COVID syndrome, but I wouldn't be surprised if there was some kind of parallel there due to other parallels. But we'll talk more about a treatment option for that a little bit later. And if concussions are so common, 1.6 to 3.8 million concussions a year, repetitive concussions can increase the risk for having chronic cognitive deficits. That's why we have all these rules related to sports of who can go back in and play more after a concussion and when it needs to stop. Um, you can have worse episodic and working memory, and you can be at a higher risk for depression. So, a quick evaluation of a possible concussion and implementing treatment strategies is really important. And we'll get into that. So, before we do that, a few more notes on sleep. Sleep is one of the most common issues with brain fog with insufficient sleep. So insufficient sleep is considered less than 7 hours per night, and chronic poor sleep does increase the risk for cognitive decline. There are some studies that show significant correlations with impaired sleep and Alzheimer's cases. One study estimated as high as 15% could be attributed to poor sleep, which is a pretty large number. Um, the reason for this is your brain is really doing a lot of recovery during the night. And if your neurons don't really have the time to recover or not recovering optimally, then they're just not working optimally. And you may have heard of studies showing that insufficient sleep and can reduce reaction time and cognitive function similar to being drunk. That's not just getting a little less than 7 hours of sleep typically, but over time it adds up and you can really add on your sleep deficit. The Sleep Foundation has all kinds of stats on how insufficient sleep can interfere with various aspects of cognitive function, hindering cognitive flexibility, impeding processing of emotional information. So you may not be, understanding where somebody's coming from or relate to somebody as well. You might make decisions that you wouldn't normally make, um, and all kinds of things. And we already talked about sleep apnea. So depending on what the reason for somebody's insufficient sleep, it should be addressed as part of the whole picture plan here. Okay, exercise. So getting in to some of the treatment strategies. So exercise is a great way to improve oxygenation of the brain. In the short term, exercise can increase inflammation, but overall, long term, exercise reduces inflammation. So that's a great option. There are studies showing it can enhance neuroplasticity and protect against neurodegeneration. This is true for both resistance training and aerobic. So I like a combination of both because they can both have all kinds of different benefits. Um, Moderate exercise is even recommended now pretty early after sustaining a concussion because it can help speed recovery. All right, hormones. I'm going to touch on hormones here a little bit. So, brain fog is especially common in women in the perimenopausal time frame. Up to 60%, according to some research, has shown that 60% of women can experience brain fog. Almost, I think it might be even higher than that in my experience. Um, it can be both high and low levels of estrogen and progesterone that can cause that. Uh, you actually get fluctuating levels in the perimenopausal time frame, and then after menopause or postmenopausal time frame, estrogen is low. And there was a study at Brigham and Women that showed that lower estrogen uh, did did correlate with doing worse on memory tests, but not all women experience that. There may be different predisposing factors for that, uh, but there are different treatments. I'm not going to go into the different types of naturopathic hormone treatments because it's pretty complex. There's a lot that you might do for different individuals depending on that. But I do want to talk about some of the research on hormone replacement therapy because it's pretty interesting. Um, this is more like the research is really focused mostly on dementia, but brain fog is certainly an area that I think it would improve with this. So, the University of Arizona did a large study of 400,000 women aged 45 and older. Those who underwent menopausal hormone replacement therapy for 6 or more years were 79% less likely to develop Alzheimer's and 77% less likely to develop any neurodegenerative disease. Um, so that's substantial. Now, years ago, the Women's Health Initiative studies scared a lot of people out of doing hormone replacement therapy, but we've learned a lot since then about the nuances of what might be going on there and how it can be beneficial and what to stay away from because it is nuanced and we do have good research now. So the longer term Women's Health Initiative studies showed that estrogen therapy decreased death due to Alzheimer's and also benefits to cardiovascular disease and other things like that. And an interesting study to kind of keep your eye on if you are interested in learning more about this is this large study done by NIH, I believe, 7 million women, and it's still in peer review. So after it's out of peer review, I'm sure we're going to hear a lot about it as long as there's no issues with the study. But things that are still in peer review, we try not to jump to conclusions with because there's um, a lot of nuances that we need to get worked out. We got to make sure that the study design was done right. I would hope so with this large of a study, but we'll find out. Uh, and so there were nuances. I won't maybe read off the page, but the types of estrogen matter, the way that it's given can matter, and it's something to have a conversation with your gynecologist or primary care doctor if you're interested in, or, so, all right, moving on. Stress. Okay, stress is one of the other biggies with brain fog. Stress is another task you're trying to manage. And when you've got a lot going on, You don't need more things to juggle and contribute to where your brain is being pulled in these different directions. A lot of this is mediated through glucocorticoids, like cortisol is your stress hormone. In the short term, sometimes it actually can improve brain fog because your brain is heightened to perform quickly and perhaps think clearly. However, most of the time when we're talking about stress, it's not a short-term thing, it's chronic, and people are dealing with an amount of stress that shouldn't be going on for that long. So we have seen that higher basal cortisol levels and chronic stress may be a marker for cognitive impairment. Um, Chronic stress can also be related to inflammation, and it often goes hand in hand with some of these other causes like poor sleep. So, stress management is super important. This could be a whole talk in itself. So, and part of that's because stress in itself has so many causes. If it's food scarcity or work, infertility, cancer, being caretaker, or relationship issues. So lots of different solutions might be the answer for different individuals. I ask people, do big changes need to happen? Can those big changes happen? Are there tasks that can be delegated? If you are a caretaker, is there some of that responsibility that can be passed on to somebody else? Um, do you need to create boundaries with work or with relationships? And then the many therapies that can be useful, seeing a therapist, meditation, meditation and breathing can have a very real response on stressors later. Um, and different supplements, medications, etc., exercise, all that is good stuff. Um, stress management is a key factor here. Okay, so now we'll get into some more of the natural therapeutics. So, as we've seen, there are many causes to brain fog. Many people have multiple causes that are contributing to the brain fog that they're experiencing. What I see a lot are things like poor sleep, maybe suboptimal nutrients, history of COVID, and being distracted by their phone and being stressed. Maybe they're in perimenopause. There can be a whole gamut of things that can contribute to somebody's brain fog. So, identifying what those are and working on things holistically is usually the most beneficial. Addressing the foundations of health, which are typically seen as exercise, nutrition, sleep, and mental health, are some of the main foundations. If we can work on those and get those in a better place, we typically see big changes in the way people feel and how you're able to think. But we do really need to find the cause. Sometimes we might need to do testing to do that. We might need to look at nutrient deficiencies. We can test for things like B vitamins, B12, iron, even omega 3s and others. Hormones can be useful at times. Thyroid function is a big one. We do whole webinars on thyroid and perimenopause, so keep an eye out for those. Um, Cortisol, you can do cortisol testing. Usually people know when they're stressed, but we can get a gauge on what's happening with your cortisol and more specifically your cortisol rhythm when we feel the need to do that because your cortisol does change throughout the day. You can test for inflammation markers like HSCRP and sed rate. They don't always pick up inflammation that like post-COVID inflammation doesn't always get picked up on that. But a lot of different forms of inflammation, especially cardiovascular or infectious, autoimmune, can sometimes be picked up there. Might do a sleep study if appropriate, if we're suspecting sleep apnea. And I didn't mention some of the other tests that are out there, like gut health tests. Um, there are a lot of different digestive conditions that might be a part of that. So it really depends on the person if we think there is a lot of gut inflammation and to what degree there that is. And if there's dysbiosis or an imbalance in bacteria that can include SIBO or small intestinal bacterial overgrowth, or it might be more of just an imbalance more generally. It could be an outright disease condition like ulcerative colitis or Crohn's or celiac disease, or it could be food sensitivities or allergies. So there's a lot that you can address as far as the gut goes. Okay, so I think that's a good start with the testing. Um, so then a few other little things that I wanted to mention more specifically to give you a flavor of some of the other treatments we can do, along with addressing those foundations and really trying to get to the root cause. Um, Here are some other interesting things. So GPC is glycerophosphocholene, and this has to do with acetylcholine in the brain. So, as we saw back on the concussion slide, acetylcholine can be low in people with chronic cognitive deficits following concussion. And GPC can actually improve acetylcholine levels in the brain by providing a source of choline. And there are both human and animal studies that have shown a variety of improvements there and safety with GPC, showing things from improved motivation, slowed cognitive decline in Alzheimer's, reducing neuroinflammation, all kinds of interesting stuff there. And it can sometimes give you a little more energy too. So sometimes I'll use that by itself, or sometimes a part of a formula like Brain Vital is one. Um, that one contains several other ingredients like phosphatidylserine, which actually reduces cortisol if that's appropriate for somebody. So that's a good one I wanted to mention. Omega 3s. EPA and DHA are some of your prime omega 3s, and those can help reduce brain inflammation. Again, the brain is 60% fat. DHA, especially, can be good for the brain. Um, and low omega 3 levels have been related to low brain function. So we can test for your omega 3 levels, especially if you don't eat fish much. Even if you're loading up on nuts and seeds, omega 3s tend to be low if you're not eating fish regularly. So we can test those levels, find out if that might be a good option for you. And specific other drivers of brain fog might respond even better to that too. So that's a good option. Bacopa monnieri is an herb. I wanted to mention this is a really interesting herb, and they've done a number of human studies on Bacopa and shown overall improved word recall memory and other cognitive tests. It does take a little bit of time to work. So mostly we're looking a few months out and a gradual improvement in memory. Um, some of these, some treatments can work a little more quickly in making you feel a little more focused, but sometimes slow and steady is a really good option too. Okay. And a few other therapies. Theralite 360 is very cool. If you haven't tried that in our office, it is a evidence-based strategy. It actually works. The red light can reduce inflammation. It's used by a lot of uh, athletic teams as a post-exercise recovery, but we use it in our office for a variety of different drivers of inflammation, um, and even just helping you relax and mood and stuff like that. Acupuncture can be helpful for some people with brain fog, and other lifestyle changes like organization decluttering, even hiring somebody on to help with some of that. There's so much that can be done. So I think we're reaching the end here. So a few takeaways I wanted to mention. Um, stop multitasking. Let's go back to that. Stop multitasking. Turn off notifications on your phones. Limit screen time. Prioritize your sleep. Be protective of your sleep. Implement nutrition strategies that can help you sustain your energy. Improve brain oxygenation through exercise. And otherwise, you really need to address the cause. I think looking at some of the drivers, see if you need lab testing, and really tailor a plan to kind of help you get that focus back uh, is is really where the bread and butter comes in. So, two books I wanted to recommend. I think these are both great. There's Flow on the left, and that one is fantastic. Flow is referring to your ability to get into a deep state of concentration where you are just in the rhythm of your work or reading or a project that you're doing, and how we can kind of return to that state. Another one I recommend all the time is Stolen Focus by Johan Hari. Um, this one talks a lot about the reasons why we can't pay attention and different aspects of that, kind of how honestly I've touched on in my talk. So, anyway, I know that was a lot of information and not a ton of time, but like I said, I know a lot of you probably have brain fog, and we want to keep this moving. So, if you would like to, if you're not already a patient, or even if you are and you want to learn about if we're going to be a good fit for you with your insurance or anything, you want to become a patient, give our office a call. If you're already a patient, I'd love to see you. So have a good night and thank you for joining me. Um, if anyone has any questions, I'll hang on for another minute. All right, looks like that might be it. Hope you all have, oh, how often should you do red light therapy? The red light therapy, some of the research has you doing it twice per week. I think it depends a little bit, but twice per week would be great. If that's too much for somebody to be able to come in, I'll usually do once per week for a series of visits. Um, sometimes like maybe 10 at a time and kind of reassess as we go. The does HRT work if you have an IUD? Um, it, with an IUD, that's a good question. It depends on. Usually, they don't do it at the same time. Because I don't prescribe, that's a good question, and I probably not going to give you the best answer for it. But some IUDs are hormonal, and you wouldn't do usually any additional HRT hormone replacement therapy on top of those hormones. If it's a copper IUD, maybe. I'm not sure. Good question. You're welcome. Good. I'm glad you guys. Excuse me. I need to take. I need to take my own break and for my brain fog. Um, but I'm glad you guys held on and found it informative. I know that was a lot of information. I did rapid fire. So I hope we were all able to absorb some of that. Um, so have a good night. Thank you very much.